Everyone, welcome to therapsil's webinar on nurses' perspectives on psilocybin therapy. I am very excited to be hosting this webinar today. There's been times in the past in which therapsil has given me the opportunity to speak about my experience as a nurse, but I'm really feeling honored to be able to bring in more nurses and more voices and have more discussions on this topic. And let's see what we're doing for attendees. We have 30 attendees now, and I'm going to get started with a land acknowledgement. So I respectfully acknowledge that I live and work and play in Victoria, British Columbia. And Victoria is the unceded traditional territories of the Leewuk and peoples, represented by the Songhees, Esquimalt, and Wasanich nations. And I recognize that our team at therapsil advocates for the use of psilocybin in the Western medical context, but the whole field of psychedelic medicines wouldn't exist without the Indigenous knowledge keepers and the use of psilocybin mushrooms for centuries within many Indigenous cultures. So I just acknowledge that before we get started with this webinar. Yeah, so we have a group of nurses today from many different backgrounds, many different disciplines, some directly associated with therapsil, some connected to us kind of adjacently. And so I'm really excited to have this discussion today. We're going to kind of have some open-ended questions. We're gonna get together and chat, and then we'll save 10 minutes at the end for Q&A. And feel free, anyone who's part of this webinar, to throw your questions in the Q&A section. We have a Q&A section, right, Holly, for them to throw their questions in? Pretty sure we do, yes. So throw your questions in there, and we'll pull up some questions at the end to touch on if we have time. And we'll start off with some introductions. So I'll just introduce myself first. My name is Natasha Fearnley. I'm a registered nurse, and I'm the clinical intake director at therapsil. And I am really very lucky to be able to spend my days doing this work actively and to interact with a lot of patients who are pursuing psilocybin therapy and kind of be on the ground with the clinical processes we're creating around nurses and patients and practitioners in their pursuits of this treatment, and helping to push for regulations to be created. And I have many amazing nurses on the call with me today, so I'll just have them introduce themselves as well. So Josie, do you want to start off and introduce yourself?
Sure, thanks Natasha for starting us off there. My name's Josie. I'm a registered nurse working and living in the East Kootenays. I've been a nurse for 6 years. I worked first 4 years of my career in acute, intensive, and emergency psychiatric care in Victoria, and since have left that department, and I currently work in the operating room. I found plant medicines as a healing modality for myself about 6 or 7 years ago, and from there began to involve myself in integration groups. And that's kind of involved my passion for this kind of work. I think it's a really important topic to be discussing, especially in this global climate we're all experiencing right now. And I'm really happy to be here. Thanks.
Vanna, would you like to introduce yourself?
Hi, I'm Vanna. I am a registered nurse as well. I started off my practice in primary care. Then I moved into hospice palliative, and now I work at a correctional institute called Kent Institution. It's a maximum security prison in British Columbia, and it is as intense as it sounds. There's a lot of healing work to happen there, and I'm hopeful that in the future that this may extend in that direction as well. I will also be working in Emerge starting May. Psychedelics, namely psilocybin, plays a huge role in my life. I went towards it because I was desperate. I was experiencing severe depression since early childhood, huge history of trauma. And it really helped me in that department. I don't know if I'd be sitting here in front of you today had I not crossed paths with psilocybin. So I'm very grateful. And I'm looking forward to incorporating this into my practice, whether nursing, whether counseling. I'm not sure where my future is going to be, but I'd love to pay what I received forward. And I'm really grateful that I'm part of this group right now.
Thank you, Vanna. Fola, do you want to introduce yourself?
Yeah, thanks, Natasha. My name's Fola. I'm out in Edmonton, so Treaty 6 lands. My background training is actually as a registered psychiatric nurse. So most of my focus has been in mental health and addictions, primarily like crisis intervention and intensive care. My personal interest within like spirituality and altered states, I guess, is kind of what led me towards more of the plant medicine world. And so I work like right now in private practice, just supporting people with integration and alternative ways of healing. So that's kind of where I'm at. I feel like just being part of some community of practice here in Alberta, across Canada, that there's definitely a need for more nurses within like the plant medicine world. So this is really a great conversation to have. I'm glad people could come on and look forward to hearing some of the questions. So thank you.
And Sarah.
Hi, everyone. My name is Sarah Lovegrove. I am joining you from the Sunimo First Nation, otherwise known as Nanaimo on Vancouver Island. I'm a former emergency department nurse as well as a sexual assault nurse. I left my full-time position in October of 2018 with PTSD, fairly severe. And in the last several years have found healing through the use of plant medicines, cannabis, psilocybin, and ayahuasca specifically. Through that healing journey, that immense healing journey, I have also transformed my practice from nursing into sort of a post-nursing practice of educating individuals with psychedelics and cannabis. So a passion of mine is integrating these plant medicines and these practices into Western medicine. So in another part of my passion in this world is the healing of nurses and giving nurses the opportunity to heal the way that I have. I had the privilege of leaving the bedside before COVID hit. And what I see in other nurses now is an incredible amount of trauma and wounds that they're holding on to. And I see psychedelics and pure trauma-informed practice as the opportunity to heal this profession and the individuals in this profession. So I'm really grateful to be here and to share my story and to hold space with all these other beautiful nurses. So thank you. And I look forward to this chat today.
And so I'll start off by just throwing out the general topic of conversation of like, what do nurses bring to the table that's beneficial for psilocybin therapy? What do we bring to holding space or preparing people to do psilocybin therapy? What do you guys think?
I can go first.
Yeah.
I think nurses have the most incredible mix of training and experience to come together to hold space for people through these experiences, because we're trained professionally to hold space for people at the hardest times of their lives, in the most difficult moments, the most trying moments, and holding that space comes naturally to us in this profession. I think it just creates just a natural way for us to transition into this medicine world.
Yeah, I think too, our like excellent assessment skills really come into play when you're assessing people's readiness for this kind of therapy, and in preparing people for this kind of therapy as well. I think it's really important to be able to assess where people are, and that's something that we do on a daily basis when we're working as nurses. And yeah, like Sarah was saying, just like holding space for people. We hold space in so many different ways and in so many different departments. And for people who are in all kinds of different states of consciousness, whether they're, heightened because they've got a new diagnosis, or they're going through palliative care, or medication changes. And the list just kind of goes on.
And something that I've experienced and that I see that nurses bring to the table is like an understanding of policy development and like policy and procedures, and just like helping to build the structure of what this is going to look like, as well as holding space for people. So it's kind of like funny. I know Josie and I have had a conversation before around how nurses are kind of like a little bit of everything. We're like a little bit of a doctor, and we're a little bit of a therapist, and we're a little bit of an administrator, and we're a little bit of a a little bit of OT and a little bit of, and so we bring this like holistic approach to people that you need when it comes to psilocybin or psychedelic assisted therapy. And we can help to kind of enact a new way of bringing this into the Western medical model from our understanding of the Western medical model, and then our understanding of the holistic approach from having all of these different skills within our profession. And that's something I really see is really valuable for us moving forward.
Mhm.
I think something else too, like is knowledge of medication and interactions of medication, which is something that not a lot of other professions, therapeutic wise, counseling have. And so psychedelics and psilocybin specifically has a lot to do with their serotonin system, and that interacts with a lot of mental health medications and can actually cause some pretty severe side effects given the wrong interactions. So I think the knowledge around medications and how those interactions happen is just something that is brought naturally with nursing as well.
Yeah, that's what I was going to say as well, Sarah. That's what I find most people coming in are like, oh, I'm interested in doing this work, or what should I know? And they don't really feel comfortable maybe bringing it up to their family doctor, for instance, right? Just out of judgment. So I do feel like as nurses, we have a positive influence there, and to provide education. And like you said, Natasha, really like to provide this like well-rounded sort of perspective, like body, mind, soul, like what exactly is going on? How do we hold the space for someone? And we can like provide that kind of like circular container for people. And in addition to supporting colleagues, because there are a lot of psychologists that I have conversations with, and they want to understand some of that. So I think as a team approach, it can be really beneficial. So, and I see Gordon's comment there. It's like, oh, I hope I'm not intruding as a psychologist. It's like, no, it's good to have these networkings and interactions with each other. So, yeah.
Oh yeah, it makes me so happy to have non-nurses here. Like, thank you for being here if you're not a nurse, and you're here to hear what we have to say and to see what we have to bring, and so that we can all collaborate, right? This is multidisciplinary is the way to go moving forward. And especially I see with a lot of the patients that therapsil supports, they have complex medical needs, right? It's different if there's someone who's a healthy normal, whatever that means, and they're being supported by a therapist, and the therapist is just thinking about, their emotional and their psychological needs. But when it comes to these people who are searching for psilocybin and they're medically complex, you need to have that medical perspective to ensure that it's safe for them to do it. And it's really nice that we bring that, but then that we can collaborate. Like, it's just part of the nursing perspective is a multidisciplinary approach. Like, that's what we do. We're kind of the middleman between all practitioners, and we're always kind of collaborating and working together. So that just comes naturally to us. And I think we also bring that to the table of just kind of encouraging the multidisciplinary approach with our way of being. Mm-hmm.
I've certainly found for myself, like actually in practice with this type of therapy with people, there's a lot of comfort for people when they know I'm a nurse and that I have a lot of knowledge around medications and how those things might interact for them. There's comfort for people in that I've experienced anyways. I think that's important.
Yeah, also people just knowing you're a nurse, often they know that you've been around a lot of vulnerable situations, and that's something you're comfortable with. Like, they're like, oh, you're a nurse, you help people go to the bathroom, or you do these like things that are so intimate that they know that you're comfortable with that like vulnerability. So they feel comfortable within the vulnerability. Mm-hmm.
I think also if we look at the personality traits that nursing could potentially bring in, it's yes, there's a lot of compassion and empathy and all that is put into our syllabus, but I think it's also the people that are more naturally drawn towards those personality traits that might go into nursing. And for a lot of us, for a lot of the nurses that I've met, including myself, we have this ability to sit with darkness in a way that a lot of people tend to shy away from. And that could potentially come from either our own background or just working in certain areas that allow us to hold that space for people to experience all ranges of experiences, not just pleasant ones too. So I think that was really beneficial.
Yes.
Something I've been thinking about that is like kind of, I don't know if I want to use the word controversial or just a topic of conversation that comes up a lot, and I'm not really sure what the right answer is, but like, how do you think nurses play a role within providing psilocybin-assisted psychotherapy? And do you think that nurses have the skills to be the primary therapist for psilocybin therapy? Can they provide the therapy component? Do they need to be just the secondary therapist? Because do we not have those skills? And that's just kind of up for debate. And I have my own opinion, but I would love to kind of throw that out to you guys. And what do you think?
Yeah, I have something to say about that. Just from my own experience, actually going through therapsil training and being one of a few nurses that were in the group, the rest of the people being majority registered clinical counselors. It was really interesting because I found that for a lot of the counselors, they had difficulties with this type of therapy because it doesn't fit into the classic modalities that they're taught and how they counsel in their practices. And so for a lot of those people, they found it difficult to like backpedal in the practices that they would normally use, because the type of therapy that you're doing when you're holding space for someone in this container is like not talk therapy. Like you really are just holding the space. And again, like going back to what we already talked about, nurses holding space and like across the board in various situations is like the ultimate skill, and in that darkness too. So I think like in some ways as nurses are more prepared to sit and hold that space and like actually be with the discomfort of like not talking with somebody while they're going through this process, and allowing people to actually go through the process themselves and use their inner healer to find what they need. And instead of like, yeah, being in that talk kind of overthinking relationship. Not to rag on clinical counselors, they are wonderful and they have a place in this setting as well. But just from my own personal experience, that's kind of some thoughts that I had.
To quickly piggyback off that, Josie, I think that I see you kind of speaking to the difference between help, like guiding someone to trust their inner healer and to kind of know that they're the ones and hold space for them to kind of do it themselves, versus sometimes with registered clinical counselors who are kind of struggling, maybe not all of them, some of them are come really naturally to this, but some of them who are struggling with this change in perspective or change in approach with psilocybin therapy, it's because they're kind of the one help, like causing the person to kind of heal. I think, I don't know if I'm saying that right, but it's like, it's a different perspective when you step back and you like let the patient take the lead, is different with psilocybin therapy from my perspective.
Yeah. That was what I was going to say in a bit. Like, I think nurses can hold this space independently, because a lot of times what the work actually is holding safe space for the medicine and the individual to do the work together themselves. And it's not necessarily about the person holding the space, whether it's a therapist or what comes up or what's brought up within that therapeutic relationship. It's more about allowing the medicine to do what it needs to do, and trusting that process and allowing that process to be engaged in a safe and therapeutic way. And I think nurses can do that in a full context without the secondary with them or being the secondary. And we're also more comfortable with the somatic side of this work, wherein we're used to touching people, we're used to being physical, like in the ER, like being one-on-one, having that touch constantly is something I'm very familiar with, where I think therapeutic from more like professional perspective is basically very hands-off. So I think we have that upper hand in that work.
Something that comes to mind. Oh, sorry, Fola, you go.
That's okay. Oh, I was going to add, because I think I kind of see it as a combination of both, right? And yes, nurses come from more of like a feminine sort of approach of nurturing, caregiver, holding that container. And whereas like clinical psychologists and so forth, you know, much more, I mean, was a male dominated. Same with doctors, male dominated profession. So there's kind of like two sorts of perspectives that come in. And that's why it is important, I think, to have both present, and that there's no hierarchy though, that it's like both people that are present being in, whether you're a man or a woman doesn't mean that, you know, the psychologist is a male, the nurse is a female, but knowing that we're in like that energetic approach to holding space for someone and being able to like move through whatever is needed. And that we need that balance in order to really hold these spaces and allow people to integrate whatever might be coming up for them. So I see that as the benefit of having someone coming in with like a nursing perspective, is that we are able to kind of provide that sense of balance in a world that has kind of been one-sided for so long. And I think that's kind of what all this medicine work is doing, is bringing in more of that sort of like nurturing, feminine, intuitive, like healing capability for everyone involved. So yeah.
I really appreciate that perspective of the masculine container and the feminine energies, and both working together, because in all of the medicine journeys that I've been on, that's been actually the most important, like just having that presence of both of those energies available. And with regards to nursing, I just wanted to add that, like, I agree with everything that everyone said. And I think it's also important that we have nurses that are experienced. So not necessarily just because they went through the nursing program, like the new grads, not to write them off in any way, shape, or form, because there's such a potential for new grads to pick up things really quickly. But nurses that have actually been practicing for many years, we develop a certain set of skill sets. We develop the ability to handle discomfort in ways that we necessarily weren't able to do so before. And then if we were to tag on the training, like through therapsil and through other modalities, whether it's somatic experiencing, psychotherapy, yoga training, all of those extra, not extra, those are all very important. With all of those additional knowledge and wisdom that we gain, I think we could definitely be a primary provider in that sense with regards to psilocybin therapy.
Yeah, I love that, Vanna. What I was going to touch on is just like, you know, having the responsibility as professionals within our designation to only do the work that we feel that we're competent in doing. And it's part of therapsil's requirements for our training that any nurse or any practitioner have at least 5 years experience working with the human psyche. So you have to be experienced in some manner to then get into the training. And then there are so many other continued education modalities that we could then take on to specialize ourselves in the ability to provide this treatment. And as nurses, we're constantly doing continued education. And so I know for myself that continued education is often focused on things that provide me even more skills to be able to provide this. So like you said, yeah, new grads, they're not ready to do this work yet. But an experienced nurse who's continued their education and focused their skills on being able to provide this therapy is perfectly able to be able to hold space for people and to do the therapy in the ways that it's needed. Yeah, does anybody want to touch on, well, maybe I'll frame this a little bit different. So I know from my experience, I've connected with some nurses who are working actively in providing ketamine-assisted psychotherapy and creating trainings. And they've let me know that the BC regulatory bodies are supportive of nurses providing this treatment and doing this work. But I haven't personally gone to my regulatory body to ask. It's actually on my top to-do list. I'm going to send some emails this week. But does anybody want to speak to their experience with their regulatory bodies, or how they feel about doing this work, if they feel as though it's supported or not supported, or anything that comes to mind when it comes to our colleges around this?
I personally have not had any experiences with my college per se around this. I have heard of other people's colleges, you know, reaching out to the therapist, having questions like, what is that about? But I know this is kind of a touchy topic. And it's, yeah, when you say that, Natasha, I think like, okay, but then, you know, because I also support the university here with nursing students, and there was a nursing student in the ketamine clinic at one of the hospitals. So there it's okay. So obviously, you know, it's like, it'll be interesting to see what happens when people go private practice versus in the healthcare system. What does that look like? Are there going to be times where they say it's okay in the one and not in the other based on, you know, I mean, there obviously has to be certain supervisions, especially with the ketamine work. But that's somewhere that I'm really not too sure. And we see it with, you know, people utilizing psychedelics or other plant medicines for their personal healing, and having just to be mindful with sharing that, depending on whether or not they have an exemption, right? That can also impact. So I think in the next year or two, that will be coming up more. But I mean, lots of conversations hearing from nurses who are turning to this type of healing work. And there's that, yeah, impending sort of uncertainty. What will this mean? What will this mean? So I'm interested to hear what other people have come across with their colleges.
I'm actually originally from Ontario, so I'm still getting used to BC's regulatory body. So I'm not quite sure. I feel like Ontario might have been a little bit more open with regards to nursing, and I'm not 100% sure, so please don't quote me on this. But I was actually curious about the role of medical directives in this particular area, and if that could potentially open things up for us and allow us to do that primary care piece. But I'm not. That's kind of what I wanted to ask.
Vanna, I actually come from Ontario as well, as where like I trained there and learned that sort of practice a little bit more in depth. And I found it interesting coming from Ontario because psychotherapy is a part of our scope of practice in Ontario. And so that's actually something I brought forward to Natasha, just saying like, you know, if that's the precedent in Ontario, why isn't that the precedent across the country for nurses? In terms of my personal experience with the college here in BC, my experience is more as a nurse who was using these medicines for myself, and I didn't feel comfortable with the reaction of my college to continue to hold my license and to pursue these medicines as a healing modality as freely and as openly as I felt I needed to. So when I had PTSD and I knew my options of either the medical route of care with pharmaceuticals or plant medicines, I decided to go the plant medicine route, and was almost immediately questioned by my college in terms of how and why and how I felt as though I was capable of being an educator in this space. And so I think there's a lot of archaic stigma around plant medicines and substance use in general around these colleges and professionally mandated groups, whether that's doctors, therapists, or nurses. And substance use is something that has to be sort of reimagined and reconfigured in general, especially cannabis, which is a legal substance now, and these psychedelics, which are receiving more exemptions and more decriminalization and legalization attention. So, yeah.
I can't say I have any insights or experiences directly with the college. I'm also in British Columbia. I've just kind of heard through the grapevine that they may be okay with some of the things that are going on. I also personally hold an exemption that the federal government gave me to use psilocybin legally. So that hasn't been a topic that has come up with my college specifically, though.
Yeah, just to clarify, I don't know if I mentioned earlier, but I'm also in British Columbia. So that's the regulatory body I was referring to. And I also hold an exemption, like as well, that Josie holds, to be in possession of psilocybin for training. So I think that it will be interesting as I reach out to see what type of response I get. And I will keep everyone in the loop when I find out more about BC's regulatory body and what their perspective is on this. And what do you think needs to happen for psychedelic therapy and harm reduction and the whole approach we're talking about, for it to be, for nurses who are going through training to be more informed, for this to be part of training that we can access so that this can be integrated into our practice What would you guys hope to see going forward when it comes to educational opportunities for nurses regarding this stuff?
Honestly, just being with MacEwan, my hope would be to have a course about all things like holistic, spiritual, plant-based, to really provide, we always talk about psychospiritual, no, my goodness, biopsychosocial, thank you, spiritual like support of that holistic approach. But I've always felt like it's missing something. So to like really reach out to nurses when they're learning, prior to coming onto the workforce, because let's be honest, it can be a bit of a challenge. And that's just the way the world's going. I feel like that would really help them to feel a bit more prepared and to also be able to hold space for, the people that they're working with in different ways. So that's my personal thoughts about that. And then like Sarah mentioned, just with like the nurse to nurse peer support piece, like the organization that I am a part of is Nurse to Nurse Peer Support, and that we're very much about like, how do we hold these spaces for nurses, not from a plant medicine stance, but just support that's trauma informed, and like we can ensure that people who are going into the workforce as a nurse really have like the awareness of what works for them, the self-care, do their healing when it's necessary for them on their time. And I feel like all those pieces can really kind of support individuals to promote healing within and then in their patients, right? Because it's like we mirror out what's kind of going on for us in our outside world. So it's like mutually beneficial sort of experience. But yeah, that's what I'd like to see happen.
I'd really love to see cross-cultural management of mental health being added to our curriculum. Like I really appreciate the Western modality of medicine because I'm here, I understand the benefits of it, but we're definitely missing quite a bit, especially in the mental health realm, because we tend to treat everything like a disease. And that's not necessarily the case. And I won't go too much into that. And the way other cultures view it, especially just cultures that we may not look to for education, they actually might have a much higher understanding of mental health and how to support it in a very holistic and healthy manner without ostracizing people. So I think I would love to see more of that in our curriculum, especially in school. And another thing would be to actually include in the practicums in the future. It could be at ketamine clinics, it could be at psilocybin clinics, depending on what this whole psychedelic realm looks like in the future. It would be really cool to see that. Maybe they won't be taking the counselor role or holding the space, but they could have other opportunities to get involved and really understand this area through practice instead of reading it out of a textbook. So it'll be really cool to see if we can create that along the way, with the idea of, eventually we're going to have practicum students in this space, just to kind of incorporate that so that could be easily slid in. That would be really cool.
Yeah, and I definitely think that like our curriculum is really lacking in the mental health education. Like the program I did, for example, was severely lacking, which like as a young person going through nursing school, you don't really realize until you hit the floor and you're in it in acute care, and you're like, holy moly, this like mental health piece floats its way into every aspect of everybody's lives. And the way that it's handled is just, I don't know, for lack of a better word, kind of archaic in a lot of ways. And, even the substance use piece and the lack of harm reduction in acute care, and, like how much substance use is a part of so many people's lives. And it's like very much medicalized, and these things that like go on with our bodies are so medicalized and I just feel like we're just lacking so much of that mental piece in our care and in our curriculum. Yeah.
And I forget that because as a psychiatric nurse, it's like the exact opposite of that, right? So thanks for pointing that out. Yeah.
Yeah, and it was a super big wake up call for me, Fola, because I went in, I did the RN program, but I went into acute care psych nursing like right out of school. And yeah, there was a huge education gap there. Huge. It was dumbfounding in a lot of ways, and it was a steep learning curve for me. And I don't take my experience in mental health nursing for granted at all. It like spills out in so many good ways into my life now and my practice as well, in other nursing realms. So, but yeah, there was a big lack of education there.
Well, I like what Fola was saying about tying it in early to the education of young nurses, and tying this piece of like self-healing and resiliency into like weaving it into nursing practice from the very beginning, and teaching nurses how to care for themselves and how to identify their own trauma and how to do that healing work to better care for the people that we're trying to serve. And just creating like a healthier nursing environment in general, rather than, you know, like you said, just throwing nurses into these scenarios, because I don't think that's healthy for anyone. And that will sort of, I think, in turn, open up the opportunity for self-healing and self-education with psychedelics. And it's an important piece that we're really missing in nursing school. We kind of just lump it all into like alternative medicine, and it's just like alternative pain management is like all lumped into all these, I don't know, we don't even talk about it. So I think we need to really just start talking about it and destigmatizing it in schools from the very beginning.
And I see two threads here. I see the hope that nursing curriculums kind of integrate all of these modalities and more knowledge about this, and maybe even like education about pharmaceuticals includes like psilocybin and MDMA and things like that into the model. Self-care and holistic practices are into the education model for nurses. The holistic perspective, holding space, harm reduction, all of that, all of the things in the education model for nursing students. But then also where we're at in reality is we have so many nurses who are already nurses. They didn't get that in their training, and being a nurse is hard, and they're dealing with the traumas of this work. So there's also the education hope of re-educating nurses about how to care for themselves and bringing them into education models in which they can use these medicines and use these modalities to heal themselves. So then they can then provide this care. So it's kind of like we're kind of trying to clean up the mess that we've created through the missing of what we needed within education now. And it's like focusing on both roads at the same time will then hopefully lead to healing the nurses who aren't okay, or who can be better healers. Maybe they are okay, but this is just going to make them stronger and be able to heal people better. And then also bringing in the new nurses with this knowledge that we want them to have to be able to move forward in their career, being able to be stronger and be educated on these modalities and heal other people. So I see both things needing to be focused on, and both things being really beautiful.
Yeah, and I just want to add to that, if I can, Natasha, real quick, like, because I've gone through my own training through other organizations, you know, just because of my personal interest. So it's great that therapsil, you guys are doing a lot of this work, because there's such a need. It's what I also realize is that not everyone is open to it, like, you know, so especially nurses who maybe been around for a little longer, or, you know, because it's like, this is how we do it and so forth. But I love the idea of having that as if we could reach everyone and provide that, so we are all coming from that harm reductionist standpoint, that would be awesome. But I think it'll take some time to kind of, you know, the generations and so forth. But yeah.
So true.
Yeah, there's definitely a big mission of breaking the stigma. And I think the more people that are open about them pursuing these different modalities, and we talk about like alternative therapies, like it doesn't have to include taking a substance and having an altered state. like just understanding of psychedelic frameworks and understanding of altered states brings into like the paradigm of your perspective of reality that there are other ways of healing. Like it could be breath work, it could be connection to nature, it could be yoga, there's just all these alternatives that are kind of forgotten about because we're kind of stuck in this Western medical framework. And so I know we're often taught in the training that I do with therapsil that, you know, start off small. If a patient's never experienced psilocybin before, maybe you start with breath work and you just do some guided meditations and you see how they sit with that. And then maybe you do holotropic breath work, which is a little bit more extreme. And then you build up. And maybe it's the same way with nurses who, you know, have been doing this forever and they're not open to psilocybin. We don't have to throw psilocybin at them. We say like, okay, there's these other ways of doing, and let's just look at the other options and what is okay for you, what feels safe for you in these alternative methods. And we like gradually win people over about changing the paradigm and changing their perspective, I think is the way to do it. Mm-hmm.
I actually love that you shared that because I've noticed a huge shift. I love talking about this kind of stuff, not just psychedelics, but altered state of consciousness through breath work, through meditation. There's so many different modalities that a lot of us aren't really aware of. And since joining at my workplace, I kind of I share my experiences and I talk a lot about it. And within just a year, I've had my manager reach out to me about certain topics and asking me questions and getting curious and wanting to include her family members in and possibly looking at alternative modalities to dealing with depression. And just been so many people within my workplace who were extremely closed off in the beginning, who looked at me like I was crazy, just because I've been talking about it and openly answering questions. Not just me, there's other people too. I've noticed their mindset become maybe not shift to, okay, this is cool, just more towards, I'm curious about this, I'd like to learn more. So the more we can, like the mycelial network, the more we can, I guess, be open about it, the more people at least become curious and at least not as closed off as they used to be.
And what about psilocybin regulation? I know therapsil is really working hard at trying to draft regulations, bring that to the Minister of Health and to Health Canada, and be like, we need regulations. This needs to be put forward. But like, what is the group's perspective on regulations? What do you think how will that benefit people? What do you think it will bring for changes in what we can provide as nurses? Anybody have any thoughts about that?
Start. I think that the availability of a safe supply of any medication and any drug is important from a harm reduction perspective. So the regulation of psilocybin will allow for a supply of this medicine to be available for the people who need it. So right now, having it be illegal and be a prohibited substance in our country, it keeps it sort of behind a veil and behind an illegal access point, which makes it a higher risk substance for people to ingest in general. So having it regulated keeps it safe, and it keeps the people who are consuming it safe. So I think providing that regulatory framework around psilocybin provides safety and comfort for both the person who is consuming it as well as the people who are providing this form of therapy. And it just provides that another added level of safe container to this work.
Yeah, I just echo what Sarah said completely, because otherwise people are going out and they don't feel comfortable to come forward when they decide to go and do these types of workings, and it just puts people at risk. So I think it's great to have some regulations in place.
Yeah, a big part of my perspective with this work is just there's a lack of education in society about how to do this safely. And so there's a lot of like articles going out saying like psilocybin will cure your depression. but people don't know how to do it within a safe, structured framework like it is in the clinical trials that's proving this is effective. And they don't know where to go to get it either. Where if there's regulations, there can be physicians who can prescribe this and then refer to somebody who's trained to do it, or there can be clinics where people can go in and get access, or there'll be ways for people to access this in a way that's safe, where right now it's kind of therapsil's helping people, but we only have a limited bandwidth, and there's a couple other organizations out there providing people support, but it's really, really hard for people to get what they need, what they're searching for in a safe way. And so once regulations are created, we can move forward with what we know needs to happen to the system so that people can access this safely.
And can I just add one more? Because I'm just thinking about Vanna, what she was saying before, though, like around like the cultural pieces too. I think that's something to be aware of, because I know, you know, people of color, for instance, might not necessarily go into certain places. But so what will that look like in the future? And I guess, I don't, maybe you unmuted yourself to speak about that.
Well, actually, yeah, I
Go
wanted
ahead.
to touch on that cultural piece. So thank you for bringing that up, because I'm all for regulation, and the safety element is just so important, especially in North America, because these are substances that have been used across the world in many different cultures for centuries and millennia. So there's a different context that it's used there. So in North America, it is going to be more of a medical model, and I can totally understand and respect that. The only thing, and this came up when I was part of the Toronto Psychedelic Society, is that one of the shamans, she's also a registered clinical counselor. And her question was, this is like a lineage that she's part of, and she's been practicing, and her family's been practicing with these medicines for quite some time. And so one of the shadow sides of the regulatory piece is that it could potentially keep away practitioners who may not fall within the medical model, but who have a lot of experience. And I don't mean present life experience, but transgenerational experiences. So yes, I'm all for the regulatory piece, but then how do we also include this other piece where we are borrowing from a lot of cultures, we are borrowing a lot of knowledge? So that is a tricky piece, because I don't have an answer to that, but I do want us to keep that in the forefront of our minds too, as we're pushing for legalization, regulation in the medical model. There's also this other piece that we should probably be mindful of.
I really appreciate that you said that and brought that up, because the Western medicalization of psychedelics is problematic in general. I think for what you said, sort of erasing that indigenous knowledge, the intergenerational knowledge that comes with this shamanic kind of work. As someone who's been on the receiving end of this healing work, I can vouch for the fact that nothing about the medical model was healing in terms of accessing this work. So I switched entirely from this Western medical model of viewing life and healing and medicine to seeing it the other way. And that's where I found my healing with this medicine work. So I think that's worth considering, and it's worth noting in terms of regulation that it can't just be sort of lumped into the medical model. There has to be a hybrid. Mm-hmm. And so I think that's one of the ways I see decriminalization and regulation kind of marrying together, opening up the opportunity for these medicines to be utilized within the indigenous practices that they've been used in since time immemorial, but also regulated in the sense that we can access these medicines from the Western context and using them to heal people from that context as well. So bring the two together, truth and reconciliation, right? That's a part of how all of this game works. So yeah.
And just like we were saying before, you know, having like two practitioners come together, feminine, masculine, it's the same thing, like Eastern, Western, or, you know, the traditional way, the conventional medical model. It's like we're at that like precipice of the two merging into the one. And how do we do that? I think just having more safe spaces for all people to come forward and to speak and share and learn from each other. I think, you know, without any judgments or anything, that's going to be a huge support. So it's great to have like conversations like we have tonight.
Yeah, I agree with everything all of you guys just said. And yeah, I just want to echo that. I think it's really, really important for us to tread that line very carefully. Yeah.
And something that's been coming to mind for me lately regarding like equitable access is the potential to transition from this two practitioner model to maybe a group model. in which patients are in a group setting and they might not do the medicine together, because it's good to, you know, have a safe container where you're being sat for individually, but their preparatory and their integration to do that as a group, and to be supported by peers within your group, and to make that more affordable then for people, if they aren't having to pay two practitioners who are going to charge who knows what an hour. Like, that's expensive. And I know that, like, with my organization therapsil, we're trying really hard to create compassionate access funding models and be able to provide people funding who can't afford treatment, but there's only so much we can do and only so much time we can spend organizing that. But if we bring people together in a group, I think that that can be one step in providing things in a more affordable sense. And then also the group provides that support from individuals together. So hopefully we can have groups of like-minded or people that feel as though they have some sort of connection to the people beside them. Like, it will probably start off that the groups will be patients who are facing end-of-life cancer. And that's what connects them, is they all have that in common. But maybe we have groups in which they all identify as LGBTQ+, and they're all together and they're supporting each other, or other groups who feel as though they have something in common and they're going through this process together. I think could be a really beautiful way to provide this therapy.
And the group model, actually, there, just to speak from personal experience with like ayahuasca ceremonies versus psilocybin ceremonies, it's a totally different dynamic, and the level of healing that we get. I mean, a lot of our traumas come from another human, and it's in that context that we develop our traumas, and healing also can happen in context of another human. And so that group, I love that idea. I didn't even think about that within the Western context, but yeah, I just wanted to echo what you said. That's, I think that would be awesome.
And I think it's part of the intake process that, like, I would be assessing whether this person would be a good fit for a group, because some people really need the individual attention. And what we're seeing now is some people get their exemption, they do individual treatments, and then I'm referring them to the Roots to Thrive program, who will be doing group therapy for people. So it's almost like they start off as individual, and then they might transition to group. It would be a case-by-case scenario of whatever's best for the patient or the client. But because not everybody might be fit for a group, not everybody might be fit to be individual, and it's kind of seeing what works for each patient and being creative. And like, nurses are good at that, right? Being creative, making a care plan that's individual for that person. And group therapy is the thing I would love to pull into those plans. I have some questions here from the chat. This one's interesting. So Ian, thank you for your question. It says, I'm thinking of the phrase trauma informed. To what extent are nurses trained in how psychological trauma arises? Are the ideas of Bessel van der Kolk, Peter Levine, and Pat Ogden and other trauma workers generally known or familiar? And then he says, maybe Fola would have a different experience than the others.
From my own personal experience, I would say most nurses I've ever worked with don't know who any of those people are, and definitely worked with some people who are like quite personally trauma informed and have followed those people extensively themselves. But I don't know, I guess from what I know, I would say vast majority of people are not aware of those trauma-informed practices, and those people who have put so much work into the trauma-informed world.
I think this comes back to the needing to be experienced and have continuing education to do this work. And so, and also comes back to the hoping that we can adjust the nursing educational model to include this information. So hopefully, you know, as the paradigm shifts and as people are educated and as stigma changes, trauma is created as part of the education within nursing education, but also through my work of continued education and doing training that I'm doing, I'm becoming more informed of these practices and being informed on trauma. And I think that a lot of the nurses who are providing this treatment would be doing continued education to get more informed and be more trauma informed. What do you guys think?
Yeah, like I wanted to just add to that because so coming from like the psych nurse lens, you know, it is very much okay. They talk a bit about trauma-informed care, but honestly, I thought I was doing that until I experienced like my own, you know, like understanding like, oh, like I have trauma like from my childhood and things that have kind of accumulated and also from events at work. And that it's just been this like 11-year span of like things getting more and more intense. So it's honestly not even just until recently, I would say, like throughout that I've actually come to a different understanding of what is trauma-informed care and how do I show up. So it's like a combination of we can have all the education in the world, but until we really start to see it through like a lens of, oh, like experience, right? Whether or not these have to be like big T traumas or little T traumas. You know, I think everyone's gone through some form of traumatic experience in their life. Like no one, I would say, has not been touched by trauma in some way or intergenerational trauma, right? So I think there's definitely a need for more of that, especially within nursing. Yeah, until we have that, like, how are we really truly supporting people, you know?
I was an educator for trauma and violence informed practice education for nurses on the island before COVID happened. And through that education providing, I learned that not a lot of nurses are actually understanding of trauma awareness or trauma informed practice in general. And there is a huge difference between trauma awareness and trauma informed practice, whereas trauma informed practice is an embodied sense. Like we're talking about, we know we have trauma, we feel it, we can sense it in others, and we can co-regulate through our nervous systems, and that's a whole added skill set that comes with this experience that you've talked about of many years of nursing or working with individuals in crisis. And but I think we even need to be working on the trauma awareness piece. I have nurses and healthcare providers don't understand that they carry trauma, that they have like this trauma around them day in, day out. And so not even recognizing that and sort of holding armor around that takes away from their ability to be trauma-informed practitioners for the people that they're trying to help as well. So, yeah.
Yeah, I'd have to echo what everyone else said. I think there's little to no training with regards to trauma-informed practice in nursing or in pretty much any other medical field, really. It's really our own interests that bring us into that. So for me, like my past is what brought me into the trauma realm, even before I went into nursing. I just wanted to understand how to heal, and I was going through a lot. And so that's what brought me towards Basil van der Kolk, all of the training that I took through him and all of that. But that was my own personal push. And without that, I probably wouldn't have any background in trauma-informed care. So I always jokingly say I'm really grateful for my trauma because it really informed my practice. But I hope not everyone has to go through that avenue.
I love the touch on the needing to have your own experience of understanding your own trauma to really be able to understand other people's trauma. I think that that's a huge reason why practitioners need to be able to do this medicine if they're going to provide people this medicine. And like, you can't provide psilocybin therapy if you've never experienced psilocybin therapy. And also just echoing what Vanna said about like my own traumas and leading me to this, and how like I am often so thankful that the worst things that happened to me as a young human happened to me, because now I'm here trying to help other people heal from their experiences. And I often think that those are the people that get into this work of doing psychedelic assisted psychotherapy and alternative medicines, is that we've healed ourselves and now we're ready to heal other people. And I think that's beautiful and powerful. And I think there's so much strength in just being our authentic selves and meeting ourselves where we're at and healing ourselves and then bringing that to the table for other people. And I think it's beautiful. And I want more people to have the opportunity to be able to do that. Mm-hmm. Mm-hmm. And it's 5 o'clock and we've done a nurse webinar and we rock. That was amazing. So good. Nurses rock, guys.
Thanks to all you ladies for being here, and thanks to
Yeah.
everybody else who tuned in. This is so amazing to be a part of.
We're paving the way. I feel really, really proud to be part of this group. You ladies are amazing. We have to get some male nurses on next time we do this.
Yes.
Maybe.
Absolutely.
Sorry.
Okay, thank you, everyone.
Thank you so much.
So much.
Yeah.
Bye.